There's your cup. Okay. My bottle of solution. Remember how to lip it? Okay. One-inch parameter is okay. Just straighten out your paper. Gloves go on the same way you do sterile glove technique. Wonderful. Also helps to have flat rings if you're going to do this, or off with the wedding rings, not to get caught. Whoa. Okay. Oh, that was turned around in the box. Sterile to sterile. Always in the center, never back to the cuff. Between 80 and 120. I don't know if you can see that little valve up there, but I placed it up. Good time to be still over your sterile field here. Sterile. Sterile. Non-sterile. Valve. Okay? Checking the patency. Okay? Not right now, but if this was a real situation, you could use your valve. So why don't you just go ahead and do that back valve system. This goes to 100%. You can use both hands to place it. Okay. Hyperventilate. If I had a ventilator, I would turn it to 100%. Okay. Every 5 seconds, a nice breath, easy does it. Okay, 3 to 5 times. And the film told you for 30 seconds, which is about 6. Okay. Okay, now I'm ready to suction. Thumb off the valve. Place straight down in. Don't let your tubing touch the gown. Hit the bifurcation. Back just a little bit, 1 to 2 centimeters. Now I am ready to suction. Please ventilate. You want to give them time to go ahead and get their breath. Again, down straight in, bifurcation, back 1 to 2. Hyperventilate, please. Clean the tubing. How many times can you do this? No more than 3 to 5 minutes for the entire procedure. In other words, that includes your hyperventilation after each pass and the one before we even get started. Okay? If you're by yourself, okay, it's your already dirty hand. That's the fun part, getting that off without back.
Maybe a big road in there.
Okay? That's all there is to that. Now, I'm through with this, okay, because I gotta put it down, and I can't put it down anywhere sterile. But I have another backup. You should always have a backup in the room. And most of your rooms already have 3 or 4 of them in the room. So you should have a backup system, just in case you need to do this one more time while you're cleaning. Dirty, remove the dirty, check for the drainage. If this is dirty, then I should have another collar, okay? Let me get this out of my way. Disposable trash, whatever. Okay. Wash hands. Okay. Now, this is also a little tricky, and I'm going to tell you the biggest reason is because not all trach care kids are alike. Okay? Sterile gloves? Ooh, that's going to be fun. See how they're folded over? Aha. Another problem. Boy, these are old, they're sticking to the thing. Okay, thumb. Now, if you did what I just did, I don't know if any of you noticed it on this side, that one finger tapped right there. Very lightly, but it tapped. What are you going to do? I've contaminated, I need some more sterile gloves. Okay, go ahead, then pull out your extra set. And as students, I usually tell you all, put an extra set in your pocket, bring it with you. Okay, apply. Tricky in these things too is because of the way they are packaged. There we go. Thumb, thumb. The ones at Archibald, thank God, have a setup that you pull out just like what I did from the suction setup. Okay. Now, I can actually remove. Wow, this is old. It's all stuck in there. Okay. There's my basin. You're sterile gloves, so you don't have to worry like you do with the Foley that you have to come in and then you have to walk this thing down again. If I had done that, I'd say I'd go ahead and you don't have to do this little number like you do with Foley cast. All you've got to do is just make sure you're on there. Stretch it out. There's a couple of methods. You'll see different instructors and students, nurses do it differently. You can go right here, or the other thing you can do, instead of laying it on the patient, is lay it right here. Okay? Reason being, it's easier to have it here than to fall off her chest. Well-endowed ladies do not tolerate flat surfaces. Okay? All right. What you're also going to see here that is not in the film is the pipettettes. So I'll go through that with you too. Okay? Yeah. Oh yeah, with all my talk, I forgot to take out my tray. Jeez. That's okay. All right, and that's something else you can do too. You can have your kit set up. You can pour your solutions. You've got your solution to go ahead and clean off the actual cleaning site. You got your half and half to do your soaking. This one you can use for your actual sponge and cleaning of the actual exterior of the stoma itself. Okay. These have got to stay sterile. Okay, so because we don't use that, we don't dip from here and then go to the stoma and clean. Okay, we've got to keep one of these sterile to do that cleaning on the outside. You can do that first, or you can do it later. Sponge. Never around that 1 inch parameter. Okay. My contaminated hand. You've had these things for a while, can't you? Okay. Allow the solution to do its little bubbly action to start cleaning. Contaminated hand, sterile hand. Okay. Contaminated hand, sterile hand. force the excess gunk out. Okay, once or twice is plenty. Trash it. Now you're going to place it in the sterile saline. So it'll rinse. And this is where the pipettes are being used that you didn't see in the film. Remove any residue. Okay? That's something else they didn't show you is the slide turn. You do a 80 degrees so it slides right in. This is old. This is not as difficult as this look like because this is an old setup. They all slide in very nicely and they all slide out very nicely. Okay, but this is old, so that's why I'm having a little trouble with that. I've removed everything. Now I'm ready to clean my surface, my flange, and that's where my other saline solution is already prepared, and I'm going to clean it. I always suggest you bring in more applicators, okay? Lift the flange, slide it around, trash. Trash. Usually you need more than two. Okay. This is the dream world. In the real world, there's so much mucus that's dried around it, it will usually take more than two.
What are you cleaning that with? And this?
Saline.
Okay.
Sterile
just
saline.
But you could also use a peroxide too, is that something that you taught it on?
Half and half.
Okay, okay,
Never straight.
okay.
Okay, now I can clean off my surface, do whatever. And if I intend to change that, which I'm going to show you because I want to show you these ties, but you do try and dry off the excess. One sponge for one side, nice and sticky there. Toss it. Notice I'm keeping the center. It's outside, so it's really a clean technique to the outside, but as much as possible I try not to introduce any bacteria to my sponges and then dry off the other. Okay? Scissors are really nice in this case, okay? You're going to be my assistant, because when I remove this, I want to be able to replace this. I don't have any scissors.
I have some if you need them.
Yeah, if you would get me those, because first I'm going to show you the technique for small necks. And my assistant would have gloves on, okay? Because as soon as I release this, somebody's got to hold it. Thank you. Okay, we removed the dirty one, and we're going to replace the new one. Now, in this case, we're going to replace the